Welcome, everyone, to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences here at the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with our New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, you can enter those in the Q&A box. You can enter those anytime you feel comfortable, but do know that we hold those questions until the end, and oftentimes it's not possible for us to get through all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet that's posted in the chat box right now. So you can check the chat box now and go ahead and open that link if you so choose. If you are pursuing APA continuing education credits, there will also be a link in the chat box, but near the end of the presentation, near the top of the hour. So keep your eye on that chat box as the presentation starts to wrap up. Make sure you bookmark, open, otherwise have access to that link after the webinar closes. And once you complete the survey, make sure you save your certificate. We don't have completed certificate copies after the fact. If you missed last week's talk in the series, Dr. Jenny Chrisman's overview of AI use in forensic psychology practice, policy, and research is now available on our YouTube channel. The recording for this week's talk should also be available on our YouTube channel sometime later this week, and a version of slides for those that have registered for the series will be privately available to them later this week as well. And as a heads up, next week we have Dr. Dana Foreman, who will be discussing practical considerations regarding artificial intelligence use in forensic psychology. But circling back to this week, I'm very excited and honored to introduce you to today's speaker, who'll be discussing pre-employment evaluations for first responders. This is Dr. Nancy Ryba Panza. Dr. Nancy Panza is a board-certified public police safety psychologist with over 20 years of experience working with first responders. Her educational background includes a BS and MA degrees from Towson University and a PhD in clinical psychology with a concentration in psychology and law from the University of Alabama. Dr. Panza spent 4 years as an assistant professor at John Jay College of Criminal Justice in New York City, where I was fortunate enough to learn psychological assessment under her wing. And then she served 16 years as a professor at California State University, Fullerton. And then after 20 years in academia, Dr. Panza moved into the private sector as Director of Clinical Research and Development for the family of companies that includes First Responder Wellness, the Counseling Team International, and Shift Wellness. Dr. Panza's clinical work and research has focused on criminal forensic assessment and police and public safety psychology. She's worked within county, state, and federal correctional facilities, providing clinical and forensic services for juvenile and adult offenders, and has provided clinical and consulting services for public safety agencies across the U.S. and internationally. She has great passion for supporting well-being of first responders. So, Dr. Panza, Nancy, on behalf of the University of New Mexico, we're very excited for you joining the series and thankful for you sharing your expertise with us today. And I'll go ahead and toss it over to you.
Thank you for having me. I'm glad to be here and appreciate the forum to get to share information about a service I've been providing since I was a graduate student many years ago. It's frightening even to say decades ago at this point. And something I really like to be able to educate. It's an area of vital importance for first responder agencies, and it's one that I find there's often a lot of confusion in sort of what this is and what it isn't. So, we're talking obviously about conducting post-offer pre-employment psychological evaluations for first responders. So let me advance away through slides here since we've gone through the bio. Just a brief disclosure statement. I do not have a financial arrangement related to the content. The information that I'm going to speak about today represent my views and my take on this information. So with that said, let me just kind of dive in and set the stage. So, pre-employment evaluations are occupationally mandated psychological evaluations. They are when an agency or department, an employer, for whatever reason, needs to conduct some sort of extra level of detailed screening for their employees. Obviously, within first responder organizations, these are high risk, high exposure, high security level jobs. And so it's very common, if not mandated by state law, that anybody working in one of these positions is going to go through a psychological evaluation. You'll find I revert back often to talking about law enforcement. And it's not because I have a bias against the work done with other first responder groups like fire service, dispatch, EMS, and other first responder type positions. But the law enforcement field has really paved the way in terms of knowledge, research, legal, and policy, and in this area. They've really set the stage, and the other first responder positions and organizations have sort of fallen in line behind. So if you hear me reverting back to talking about law enforcement, that would explain why most of the knowledge and education that we have really evolves out of law enforcement. So, in a nutshell, the reason we do these is for protection. The protection goes on both ways. The psych eval is a last layer of screening to ensure both that the person who is being considered for the job is a good fit and that they are going to be able to manage this, high risk, high exposure position. But it's a protect the public and protect the person kind of a thing. So we not only want to make sure we are not putting people on the job who are not psychologically stable enough to manage it. We want to make sure that they are going to be, well suited to go out there and perform this high pressure, high stress position. We want to protect the public. It's very important that we know that the people we're putting out on the street that hold this level of authority are going to manage it effectively. But the flip side is we also want to make sure that the job doesn't hurt them. We don't want to put someone in this high exposure, high risk, high stress job if the job is going to break them. It's a really important balance to think about both aspects when doing these evaluations and considering kind of the what, where, why, and when. The title of the talk was Conducting Post-Offer Pre-Employment Evaluations. And I made sure to put that in because that post-offer piece is a really vital component to consider. This is like a sample pathway of how someone would end up, how and where the psychological evaluation would end up. And so this is a typical path for law enforcement, but it holds pretty true for certainly for fire service that the walkway up to get to this psych eval portion is very long, and you'll see the blue highlighted where the psychological and medical evaluations fall. It's almost at the very, very end. In fact, there's the application phase. They will go through some rounds of written testing to make sure that they are suitable for the job. There's physical testing. They'll have to pass that. Then comes the background evaluation. Background investigation is pretty in-depth. In some states and for some agencies, a polygraph is also required. In others, it's not. If they make it through all of that and pass and make it through the background evaluation, which is an in-depth review and poking around in all the places they've been, jobs they've held, people that know them, and they make it to that point, there's usually a final oral interview or chief's interview. And then at that point, the person is pretty much good to go and there's a conditional job offer. That's the really important piece. To get to doing a medical and psychological evaluation, the person must have a conditional job offer in hand. This relates back to some of the legal standards that are relevant that I'll mention in just a bit. We can't do the psychological evaluation, at least to the fullest extent, without that conditional job offer in hand. So if you were to step into these, one of the first things is to make sure that the agencies referring people to you are doing so at the right time and that this job offer is in place. If you're doing them before, you risk violating ADA standards. And so that's federal level law that we would be in violation of. So that post offer means post conditional job offer. The person has basically qualified. The agency is ready to hire them. The only conditions with the job offer are that they are medically and psychologically suitable for the job. So that's where we come in. Once they pass through the psych and the med eval, they're off to the job, they're hired and onto academy and training. So the timing of this is really vital. The other thing I think is really important to set the stage is to talk about the purpose here. What is a pre-employment psych eval and what is it not? Both of those are really important. For folks who might be maybe considering doing these, if you have training and background in forensic assessment, it really translates over very nicely. Forensic assessment is a very similar world. It's where most of my work was early in the career before I shifted fully onto the police and public safety side. But pre-employment evaluations are neutral, objective screenings. You are really looking at the person's level of functioning specifically as it relates to the job for which they are considering being hired. The focus is on psychological stability. How is the person? It's a present tense type of mental state issue. How are they right now? How is their psychological well-being? Are there any conditions that we think would be significantly impairing enough that they would impact somebody's performance on the job? And then I have the last point, if they're focused on suitability for the job sometimes, and I'll get into that a bit more, but we've evolved in how we do these evaluations and what we're looking for, such that we're not just ruling out people who have maybe significant mental health concerns that might impact their job functioning, but we're also looking at personality characteristics that are a good fit. And so that's more of the suitability piece. So more on that in a moment. But before moving on, just a few things on what is not a pre-employment psych eval. We're not doing therapy. We're very, very clearly in an assessment lane here. More importantly, the focus is not diagnostic. It's similar to, again, if you've done maybe competency to stand trial evaluations before, your goal in the end of that is not to diagnose somebody with a DSM-based diagnosis. That is more side matter than directly relevant. Whether or not somebody holds a current or past diagnosis is not what's important. What's important is how are they functioning, what symptoms may be present, what impairments may be present, and how would that potentially affect behavior on the job. And so how does that look for the person? Also important to clarify that it's not a fitness for duty evaluation. These are also occupationally mandated evaluations, but they're quite different. A fitness for duty evaluation comes for an employee who is already on the job. So we want to really clearly separate these two out. They are done in different ways. They have a different focus. A fitness for duty must be, the question can only be raised when there's significant concern about somebody's functioning. And again, it's once they're in the position. The pre-employment evaluation is looking at how they are prior to beginning the job. So they are different points in time. And even though it seems like, since we're doing this in a pre-employment context, it seems like we're sort of doing this to predict the future. That's not exactly correct. The goal of the pre-employment is not to predict whether this person is going to be a raging success in their job. That's not the goal. The goal is to look at how they are, what they bring in at the time that this job offer has been made, and to make sure that there is nothing about their psychological makeup or personality characteristics that would be impairing or problematic in terms of their functioning on the job. So I think those things are important to consider. Legal and ethical considerations, just like in forensic assessment work, there is a lot here. And given the brief, I've got under an hour to get through all of the information to get through, I will just leave this slide up here and you can take in the alphabet soup that you're seeing and just make a couple of points. If you were to enter into this area of practice for work, you would really need to make sure that you are aware of both federal and state laws, as well as important ethical guidelines that come into play. So you see up here under federal law, we have the ADA. As I already mentioned, the timing of the evaluation is vital. Our psychological evaluations in this context are considered a medical tool. And as such, the ADA states that we cannot ask medically related questions prior to a job offer being made. So timing relates directly to the ADA laws, and that say, we need to make sure that we are not asking these types of questions and giving our tests that are considered medical in nature until the job offer has been made. The EEOC, the Equal Employment Opportunity Commission guidelines also speak to information, particularly as it relates to the tests that we use. We must use tests in this context that have validity evidence in a job-related evaluation capacity. So we'll talk more about that when we get to the testing part. GINA is the Genetic Information Non-Discrimination Act. I think I got all the words right in there. The GINA it's a federal statute that basically dictates some of the things you can and can't ask about in the interview. It protects family genetic information, which mental health history is considered part of. So there are certain things that you may not ask about in terms of family psychiatric history in the interview, or you will be violating the GINA statutes. So we need to make sure that we're aware of all this, or we could unknowingly be asking questions that are actually illegal on a federal level. State law is also important. Many states have enacted laws that dictate whether an evaluation must be done or can be done, what that needs to look like. Some statutes, like I live in California and where I practice, we have probably the most complex set of statutes. Texas also has a pretty complex set of statutes. There are other states that do not have statutes that govern this type of work. There may also be relevant case law. So again, knowing what is relevant and what's out there and how that applies to what you do, and making sure that if you were entering into this area of practice, you were in line with that and staying on point. POST stands for Police Officer Standards and Training. Again, in my state in California, our California Post Commission dictates when these evaluations happen, who is eligible to do them, what they must look like, how they must be done. It's a very detailed procedure. And in fact, I'll show you a picture on the next slide of a manual that dictates everything within POST. So there's a lot of information there specific to anyone conducting these evaluations in the state of California. Many other states also have a POST. It may not be called POST. It may be called something similar, but many of them are. And so you would really need to be aware and on top of what's required in your state. Just for reference, at this point, the last data that was pulled, 37 out of the 50 states have statutory requirements related to pre-employment evaluations. In 33 states, I believe, this type of evaluation is required. It's mandated. 4 of them, it's mandated in certain circumstances, and then 13 states do not have a requirement for a pre-employment evaluation in this context. And that's specifically talking about within law enforcement. Far, far fewer states have statutes that cover fire service, EMS, and other first responder positions. So just briefly, the last point up there is the ethical piece. APA guidelines are relevant here. OMPE is also an APA guidelines document, but it's guidelines for occupationally mandated psychological evaluations. It would be a very important document to have reviewed and be aware of in terms of how to approach these types of evaluations. And then IACP stands for the International Association of Chiefs of Police. They have within their very large organization a police psychological services section. And that group has written a set of guidelines on recommended practices for pre-employment evaluations. And those are very useful guidelines. It's a great document. So if you were to decide, I was just the state statutes that I was just describing come from this article. I apologize in this blown up form. It's a little bit blurry, but Corey McElroy and Ben Parath published this. I want to say it was 2021. I can't read the date up there, but it really summarizes, it gives a nice picture of this statewide screening mandates and what statutes are out there and what they include and don't include. The other picture up there is the Peace Officer Psychological Screening Manual. This is publicly available. If you were somebody who was interested in venturing out and entering into this field, I would highly recommend downloading it. It's free online if you go to the California Post website. In fact, if you pop into Google Peace Officer Psychological Screening Manual, it'll come up. It's a PDF download. This is probably the single most useful resource on pre-employment evaluations that exists. A while back, this manual has been in existence for many years, but it underwent significant revisions in the mid 2013, 2014, and then it's been updated multiple times since, most recently in 2022. This is sort of your everything you need to know about pre-employment evaluations. Highly recommended as a resource if you were thinking about stepping into this world. Obviously, if you are not practicing in the state of California, the legal things described in there would not necessarily apply to you. But California statutes are probably the highest and most detailed. And so odds are, if you were in compliance with what was in that manual, you would also be in compliance within your state. That's not my permission to just fly ahead and not know what your state requires and practices. You absolutely need to know that. But just knowing that this is probably a higher level of expectations and requirements specified than in most of the other states out there across the country. So let's talk a little bit about what these evaluations look like. I'm not going to spend much time talking about history because I believe what really matters is what and how we do things today. But just so you know that these, psych evals have been happening within the context of law enforcement for a very, very long time. The original evaluations relied on the earliest version of the Stanford Binet test, and it was in fact it still served the same gatekeeping reason for doing it. We wanted to make sure that we were putting adequately functional folks on the job. But the early years of pre-employment psych evals, and particularly for law enforcement, since that's where it originated, was really just focused on cognitive testing. There were IQ tests done. The thought was you needed to have at least a certain level of cognitive functioning to do the job, and that's really all there was. Over the decades, things adjusted, and way back in the 1900s, I like to use that term now because the first time a college student said that to me, I about had a heart attack when they asked if they could cite an article from the 1900s, and I thought, oh my goodness, that's where we are. So way back in the 1900s, things really shifted, and the focus on cognitive testing faded into the background because common knowledge is that, well, of course, there is a baseline level of cognitive function that one needs to do first responder type work. There is no specific IQ cutoff. There is no specified IQ range within which one would have to fall to be able to do this job. There's actually a pretty wide range of functioning. So unless someone is significantly on the low end, this is less of a focus in terms of what we want. What we really have learned is more important, comes from what we can get more in the personality range. And so you'd see gradually from the early 1900s throughout the late and into the 2000s, the shift focused pretty dramatically toward personality testing and away from cognitive testing. In fact, when we talk in a little bit, I recommend against any formal cognitive testing within evaluation. Focus as it shifted was really towards personality, but as you all know, in the world of psychology, personality tests include a whole lot of different things. In particular, if we use the MMPI as an example, the personality nature is sort of secondary to the findings on that test. It really is focusing on pathology. And so as we started using more tests like the MMPI and others of similar nature, we're looking to screen out psychological impairment. We're looking for the presence of psychopathology that we think would impact someone's ability to do the job. However, back in the, again, late 1900s, the personality testing, we were just using the typical community, general population norms that came with the tests. The focus was look for problem areas, look for those spikes on your profile. And if they were there, consider whether they were, going to be big enough to impact job functioning. And if so, rule that person out due to, lack of psychological stability. Where we are now, as we've gone into the 2000s and up to 2025, where we are, we've really evolved in how we use still personality testing as the focus. But in many places, we not only want to consider pathology-based personality test outcomes, we really want to look at personality characteristics as well. And there's two shifts that have become really vital in kind of the focus of the pre-employment evaluation here. We not only want to use personality testing, and sure, we want to look at community norms, because if someone is spiking and is in a clinically elevated range compared to the general population, that would really be noteworthy. But we've found that even some elevations that don't reach clinical elevation range, often, a T-score of 65 or higher, if we look at job specific comparisons, if we have a set of norms that are made up from other people in their position, that these actually provide a much more accurate point of comparison. So if you're doing pre-employment and you're considering what tests to use, you're likely going to be in the realm of personality testing, but you're going to look for tests that not only offer their general community norms that you would use for anyone in the, out there you were using this test with, but you want to also look for a set of job specific norms. Many of the big level tests that are commonly used have a police and public safety report. And they will have specific norm groups for each job category. So there's one set for law enforcement, one set for fire service, one set for dispatch, one set for correction officers. And so the tests have really evolved in the comparisons that are made when we're using norm-based personality tests. The other big change is that, again, that shift away from just ruling out pathology, but also including a look at psychological suitability. How well does somebody's personality characteristics fit with the desired characteristics of the job? And again, that the peace officer screening manual that Post developed includes a detailed description of the California Post psychological screening dimensions. So these are a set of 10 characteristics that are listed up on the slide that you're seeing now. Through extensive research with multi-phase process involving meta-analytic work, involving expert input, blue ribbon panel of experts, all sorts of, an extensive research process. They considered multiple psychological and personality based type characteristics. And these were the 10 that held up through all the phases of the research as the things that were considered most important. These were developed to be used again in pre-employment evaluations for law enforcement. There is some debate as to how well this set of 10 characteristics applies to other first responder characteristics. Some experts out there say they all relate. They relate to all the first responder professions. Maybe the weight on certain ones may be stronger or lesser than others. There are other experts out there that feel like this work should also follow with each first responder group and that we should have a specific set of dimensions that fits with each job category. I have not seen any substantial research on that line. I've had some students work with me to dig in to try to see how well these hold up with firefighters. And so there's a lot of kind of underneath work, but not a lot has come out into the published literature yet to answer that question. So you can scan through and see, obviously, given the sake of time, I don't have time to go through and explain all of these, but these are the 10 traits and characteristics that in my state, in California, I am required to make my decisions with these 10 traits in mind, these screening dimensions. So I'm going to get a lot of data from the evaluation, and my endpoint is, does the data that I've collected, how does it speak to the person in terms of these 10 areas of functioning? And that's the place that I am supposed to base my decision making on. So I think that kind of gives you enough of a background and understanding of where things are. How would you actually do one of these evaluations? What's the process look like? I'm going to spend a little bit of time walking you through what things look like before, during, and after the evaluation, and what are, most important things I think you need to know if you were going to do this work. So let's start off with before the evaluation. 4 things that I've identified. We want to ensure that this is an appropriate referral. And so again, the most important thing to consider here is this a post-offer pre-employment evaluation? Has the candidate that they are sending on, or the candidates they're sending on for you to evaluate, have they received a conditional job offer? If they have not, you could do maybe some preliminary screening, but it would have to be with very safe tests that ask nothing that could be considered related to psychopathology. It's a very narrow lane, and you would not be able to do any other information. So to do a full pre-employment evaluation, you would need to ensure that there was a conditional offer in place, that the person, is at the right phase in the process, and that the pre-employment evaluation, is required for the job that they are about to enter into. The next point up there is you need to understand the job demands. Before beginning to do these evaluations with a first responder agency, I will always meet with whoever the relevant personnel at the agency are to understand what candidates will they be sending over For what jobs will we be considering, will the person be hired into? And I would want to make sure that I have an understanding of the requirements of the job. Usually that most agencies, or I would expect all at this point, would have a job description. And so for any types of, for any particular positions, I want to make sure I've reviewed that job description and that I've talked to the agency to make sure I've got all the information I know. What is this employee going to be doing on the job? Because the evaluation has to focus on looking for any impairments in functioning or behaviors or personality characteristics that would prevent them from being able to do that job. Got to understand the job to be able to answer those questions, right? The next thing up there is I need to understand the agency's risk tolerance. This is where things get a little bit gray. I've worked for a lot of different agencies over the years, and different agencies have different levels of risk tolerance. Some say, you know what, we want to only hire the absolute best of the best. Any concerns are enough for us to say no, thank you. And we want you to be really, really particular and picky in coming up with your decision. Others, and let me tell you, in the world of policing these days in particular, hiring has been difficult. Recruitment and retention is at an all-time alarmingly kind of a scary place for many agencies. And they're saying, you know what, we are willing to tolerate a little more concern as long as we know what it is up front and we can help to kind of keep an eye on it and moderate it. This is their level of risk tolerance. There's sort of a window there, and you need to understand where the agency falls before you dive in and start making decisions for them in the screening process. To put that in context, whenever I do these, there are just hard no's. There are folks that come in that are just not, no matter what the agency's risk tolerance is, they're not on my watch. Would I want to put that person through and put them out into a high stress profession or give them the power that would come with their job? For whatever reason, they're not appropriate. But there is a gray area window between the definitely good, definitely not okay, and there's that window in between. And that's where understanding the agency's risk tolerance. Well, there are some concerns, but they were from a long time ago and the person looks to be okay. How does the agency feel about that? So there is a window in there. The last part up here in terms of before the evaluation, you really want to be able to receive the background information from the agency prior to stepping in and beginning your part of the evaluation. This one trips agencies up. In California, this is required. I really appreciate that about my state. Having the background information prior to conducting the evaluation gives me a whole lot more in terms of tools and information than entering into the evaluation without background information. Your state, odds are, may not require that. And if you go into the evaluation without any information from the agency in terms of their background investigation, you are reliant solely on the information that the candidate gives you during the evaluation. When I've got background information going in, I have a point of reference. They've already done this extensive background investigation. They have talked to people, they've talked to employers, they've looked at the job, they know if the person's been fired, they know if they've been arrested. If I have all of that information going in, I'm still asking them all the same thing on my background information questionnaire, but I have a point of referral to see if the person is being honest and open. Obviously, anyone has a tendency to want to present their very best self when they're coming in for a job related evaluation. They are going to want to put their best foot forward and present their shiniest version of themselves. And I get that. We all would if we were trying to, get the job of our dreams. However, as the person who's doing the evaluation and is kind of the gatekeeper to make sure this person is okay to do this job, I want all the data that I can to make sure the information I get from this person is accurate. So the background information really gives you that point of comparison to speak to the person's integrity, how open and honest and upfront they're being. That combined with, the tests that I use, I want them to have really good validity scales so that I know how they're responding and whether or not they're being open and truthful. Those two together really help me to put in perspective the information that the person is sharing during that evaluation. So before the evaluation even begins, I want to make sure I've got an appropriate referral. I understand the job for which the person is being considered. I know where the agency falls in terms of how much risk they may be able to tolerate or not. And I've got as much background information as I can. I will say, even here in my state where it's required, I have agencies that say, yeah, but Dr. Panza, if I give you that, won't it taint your impressions of the candidate? Won't it give you information so that you are making judgments about them before you even see them? And I say, yes, because that's my job. I want to know everything that I can know about this person, even before I'm sitting in the office doing the interview with them, which is the last phase in the process. Because the more I know, the more I can target my questions to possible areas of concern. Again, they're going to sit in front of me and they're going to be stressed out and they're going to be tense and they're going to want to present their best version of themselves and say yes to all the good and no to all the bad. I need to know that going in. So usually after I have that conversation and explain the points of comparison and the accuracy information and how that really speaks to someone's ethics and integrity, the agencies come to understand how important it is to have that. So we've got everything we need to know. Let's dive in, and we get the person and they come for their evaluation. The first thing we got to do is get through the paperwork. Main things here: informed consent. My informed consent form for pre-employment is about 4 pages long. There's a lot in there. There's a lot of really important points. Most people know what's contained, or at least they know the majority of what's contained in there. I always make sure that they understand, again, and most do, that this is not a typical meeting with a psychologist or a mental health professional, that nothing that they say is confidential between the two of us, that anything that they share with me can potentially be reported back to the agency verbally or in the report that I will provide for them, and that they need to know that going in. Because that is truth. I also need them to know that they do not receive my report or my decision, that goes to the agency, because the agency is the one hiring me. The agency is the client, and that they are doing this as part of their job application process. So they do not get feedback from me. And in fact, they're not even entitled to a copy of the report from me. So those are really different than a therapeutic interaction with a mental health professional. So I always make sure to explain those points in the informed consent. Once they've gone through the consent, we'll give them the kind of the other paperwork, the things they need to fill out. I use a personal history form that I've created. Most, in either individual practitioners or firms that do these either use a form that they've created, or there are some publicly available ones that even have some norm comparisons that they use. So you want to get personal history. This is where that background information from the agency really helps, because you can look for consistency. Are they reporting all the jobs they've had? Are they reporting any legal history that may be relevant? When you ask about driving infractions, if they've had a DUI, is that in the background? Is it not? Is the information consistent? And then mental health history. I have a mental health history questionnaire also that I use. And this is going to be new information. The agency and department cannot ask about this because, again, that's not their domain, and they are doing the background investigation prior to a conditional job offer. So they can't ask of anything medically related. Mental health history would fall under that. So the mental health information is new territory that they have not really covered with the department previously. So I make sure that I want to do a thorough job of asking about any counseling, any therapy, any hospitalizations, any suicidal history, any of these things, any medication history, so that we can really spend some time talking about that. Because while the presence of any of those things in and of itself wouldn't necessarily be disqualifying, how it comes into context with who they are now, how they are, and how the job might impact them, it's obviously very relevant. So the paperwork gets completed. They fill out any of the pen and pencil questionnaire, and then and I just, sorry, put this up to cover the main areas that are asked about in the personal history questionnaire. So all the things you would typically think about. Maybe if it's a clinical client, you might not ask about legal and driving stuff as much. You might not, depends on the context of the visit. You might not ask about sexual behavior, but that is something that's fair game here in terms of appropriateness. Social media and bias. We'll talk about that as we go forward, because that's a big factor particularly in law enforcement, but for any forward-facing first responder position where it involves them being in the community. We want to really look at the presence of any bias. So these are just sort of typical topic areas. As we get in the next step, and once they've completed all of the paperwork, they're going to dive into the testing. Testing always happens before the interview happens. What types of tests are used? As I mentioned before, originally pre-employment testing focused very heavily on cognitive. I do not recommend using formal cognitive testing due to adverse impact concerns. As we know, cognitive testing comes with differences, particularly across racial groups. Average IQ scores across racial groups differ. We've known this since the 1960s. We've studied it since the 1960s. There is no test in existence today that eliminates this difference. Because of that, if you are making an employment-related decision based on cognitive testing, you put yourself at risk for adverse impact. And that is when if you're looking across different employment groups, so race is one example, gender is another, age is another, any protected groups. If the result of your evaluation means that one group is being hired at a rate that is, 4/5 rule is what we use, is what federal law recommends. If one group is being hired at a rate that is greater than 4/5 of other groups, adverse impact is in place. So cognitive testing is just a vulnerability in adding to the potential for adverse impact being present in your decision-making process. By the time they get to me for the psych eval, they've passed the written tests that are required for their position. They've passed an oral interview with a panel or a chief or someone else. If there were significant cognitive limitations, it would have been relevant at this point. It would have been identified. That said, there are still people who use cognitive screenings in their evaluations. There are people who will use a reading test. I use written narrative questions on my personal history questionnaire. I have them write about a few different topics in paragraph form. And for me, that gives me a little bit of a kind of fallback indicator of where they are cognitively as well. It's certainly not formal testing. I do not walk away with an IQ score, but I don't want one because it really adds to potential concerns for fairness, and it opens agencies up to be vulnerable for lawsuits. And nobody wants that. So in personality testing is really where it's at with these evaluations. That's where the focus tends to be. In California, our law is that it is legally required that we give 2 written personality tests, one that focuses on abnormal or psychopathology focused, and one that focuses more on normal personality or character trait focused outcomes. This differs pretty widely across the states in terms of what's required. There are some states out there that require 3 tests. There are some that just say 2 tests. There are some like California that specifies. There's one state out there that specifically requires the current version of the MMPI is used. States are all over the map, so make sure that you're aware of what your state requires, if anything. Some have no tests specified in their statutes. So most by far, you would probably be doing a disservice if you were not including personality testing to some degree, because that's really what we base our decisions on. But many people include other self-report forms. Some include screening forms, like a Beck, BDI, or BAI to screen for depression or anxiety. I'm here to tell you that you can. It's not a lot, it doesn't take a lot of time or effort to administer those. But in 20 plus years of doing these, people will just say no, 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 no. And so it's probably not worth the time and effort to give them. A lot of evaluators use a sentence completion form. Be careful. You'll see I think it's on the next slide, that if you're using projectives, keep it within its lane. You could use a sentence completion form as a hypothesis generator, as additional information to compare to other sources of data. But a sentence completion form in and of itself is not diagnostic of anything. It is not an indicator of anything in and of itself, and it really is supplementary data. Bias instruments are another thing that folks are starting to include more frequently, and there are some interesting ones out there. Again, for the sake of time, I can't even begin to go in depth. But the one thing I can tell you is that as of now, as of at least what I'm aware of, I don't believe anything's been published in the recent past that I've missed. There are no biased instruments that have been published that have job relevant norms that we could compare first responder candidates to. So, meaning there may be instruments out there that can detect various types of bias. But they are not normed for this purpose and within this population. And so they are of really limited value. And again, the guidelines and publications, the occupationally mandated guidelines and the EEOC say we can only use instruments that have been normed on the populations that we're evaluating and that have been tested out and shown to have some sort of criterion related validity to the job they're going to be doing, meaning this job is at least somewhat predictive of this, of the job relevant behavior that they're going to be performing. We don't have any bias instruments that have been tested out in this context just yet. So we need to look for that in other sources. So kind of to cap up and wrap up testing considerations. Testing should always occur before the interview. The interview is the last step. It's where we get to explore based on all the other data, the background, the test results, the personal history questionnaire. It's where we get to ask about and dive into any concerns that we have. Again, we need tests that have been validated. They should have job relevant norms. We need to always look for response style because remember, our people are presenting their very best self, and we need to understand to what degree that might impact what they're telling us. Projectives, hypothesis generator only, and bias, just be careful. We really need a lot more work in this area before we start throwing bias testing in and making job related decisions. And a word of caution, simply having used a test before is not adequate preparation for you to jump in and start using it in the context of pre-employment. You've been maybe using the MMPI in a clinical setting or in a community setting in some way. The results that we take from the MMPI when it relates to first responder populations and in a pre-employment context are actually quite different. It's a whole different world using this test in this setting. And so you really need to take some training, read some books, and be aware of what you're getting into here. So the interview, again, it's the last step. It's after everything else has been reviewed. You should go into the interview with your set of things that you want to focus in and ask about. The interview itself is a little bit like an employment interview, like a job related interview would be, and it's a little bit like a clinical interview. So both are important contexts. It should come from a very neutral kind of probing approach. But there was a time when people thought it should be a very stressful situation. We should stress them out to see how they react under intense pressure. That's not it. It's not recommended that you do a stress interview, but certainly being pointed and direct and having people talk openly about, where they are is really vital and important. So we're looking to verify or disconfirm the hypotheses that all the other data has brought in. The interview topics, this is the exact same slide that I had up in terms of personal history information. You're looking for the same things here. You probably don't need to ask everything in the interview if you've already asked it on the questionnaire and there are no concerns. You want to really hone in on the areas of concern that you're looking for. Bias. Screening for bias is very important, particularly with first responder for law enforcement candidates. In California, it is now required by law that we evaluate for bias and that we consider and screen in some way for bias. It's discussed extensively in that post manual that I showed you before. And when they first passed this law, I was really pessimistic and thought, oh my gosh, people are going to be out there given the implicit association test. And, we all have implicit association. So they're going to be disqualifying 100% of the candidates that come through. Like, how are we supposed to do this? And I'm very grateful that the law was passed and they put together a really fantastic work group of professionals who ended up developing what's called the bias assessment framework. And I know that the font on this is pretty small. Hopefully you can kind of see it and take it in a little bit. This is in that post manual. I highly recommend you look at, because what they did was come up with a grid. What you're looking for in screening for bias is looking for bias behaviors, biased attitudes, or bias relevant traits and attributes. So 3 different levels of things you might be looking for. And then across the top, it's different data sources. The first 2 columns are background. This is basically what's done by the background investigator. And again, if you don't have access to that information, you won't know what they found or didn't find. Likely, if they found a lot of stuff there, they wouldn't have made it to the psych eval and they would have been excluded at that level of inquiry. But for the psych, you've got your written instruments. These are your personality tests pretty much. And so it talks about where to look for biased behaviors, attitudes, and traits. And then in the interview. So this grid, it doesn't give you all the answers, but it gives you a guideline for how to do this type, how to consider how bias might impact someone's job relevant behaviors, and where that information might be able to come from. Please take note that in those middle columns there, published measures of biased attitudes are available, but have not been validated for use in personnel selection. So they may be useful in the context of the interview, but in and of themselves, bias test results are not strong enough to be the source for disqualification. We don't have that level of validity evidence just yet. So moving along to get to wrapping up, the last part of conducting the evaluation would be potentially getting release of information signed to access any relevant records. If the person has none, that this step is not relevant. If they have past mental health or treatment records, you probably want to get some input from the provider on that. If they are former military and they have a VA disability determination or VA rating, you probably want to get access to that. Again, not enough time to dig into any more on that level, but they're important considerations that will lead you to what happens afterwards. 4 steps here to run through briefly. First, we got to think about data integration. We have a lot of data. We got background information. We have all of our test results. We have our personal history questionnaire. We've got our interview impressions. From there, we want to look for all of that and consider, what areas of concern are standing out for me? What are the things that I'm concerned about or focused on? And from there, at least for me in my state, I'm required then to say, how do these areas of concern impact these 10 psychological screening dimensions? How do the test results raise areas of concern, and how does that impact, say, social competence? Or how does the background information that raised some particular areas of concern, how does that impact the ethics or integrity dimension? So I need to kind of go through this step where I consider all my data. I create my, list of areas of concern, and then I consider how that relates to the psychological screening dimensions. And I use that to go to the second step, which is I've got to make a decision and come up with these, evaluation outcomes. This looks a little bit, alphabet soup for you, but there's basically 3 things that evaluators tend to do when it comes to evaluation outcomes. The first one you see up there says QDQ, qualified, disqualified. Dichotomous decision. The agency may outright request this. They don't want any gray area. They don't want any options. They want you to say yes or no. This person is suitable, or they're not suitable. They're qualified, or they're disqualified. Other terms they may use are select or non-select, or recommended, not recommended. But either way, it's a dichotomous decision. Again, some states require this. Some departments or agencies might require this. Some agencies like to have a third middle ground option where we have qualified, conditionally qualified, or disqualified. Here, that third option, the conditionally qualified, is kind of that middle ground where it's still a pass. They're not disqualified, but with some identified concerns that the agency might want to consider how to factor into. The last option up here is a rating scale. It's not my favorite. Some folks do it. They provide a risk rating. It may be, a verbal term like highly unsuitable with, sort of a Likert type scale. Some do a numerical rating from 1 to 5 or something. I say you got to be really cautious here, because when you're assigning a number or a category, what do those mean? Is my 3 the same as another evaluator's 3? Are these going to be consistent? If you don't have really rich descriptions and guidance there, you need to be really cautious. So reporting outcomes, again, agencies are going to differ and states are going to differ between what your report looks like. Some agencies only want your decision. I have a handful of agencies that we work with that just want the yes or no. There's a state required declaration form that must be required for all, at least police candidates. And it's that qualify, disqualify outcome, and that's it. Some agencies want the decision sheet, and then they only want a narrative report with an explanation in more detail if the person was recommended for disqualification. So they did not pass. And then other agencies want as much information as you can give them, and they want a narrative report for all candidates. So you need to kind of work with your agencies up front and come to whatever feels best for you in terms of outcomes going forward. And then the last piece here is communication with the agency. When you're doing this work, you should have a point of contact with every agency that you might work with. This might be a personnel sergeant. This might be the background investigator. It differs a little bit from organization to organization, but you should have a point of contact, somebody that you are in close contact with and have a strong relationship with to discuss difficult decisions, to talk about disqualifications and explain why, to have those conversations about risk tolerance. This is a working relationship. You also want them to be able to talk to you about hires that don't work out. There's been multiple times that agencies, I've given them a conditionally qualified, and I said, it's not enough for me to go disqualification, but there are some concerns, and it's up to you whether you are comfortable with that level of concern. And so, and usually they'll be like, no, no, we want them, we want them. And then sure enough, 6 months later, they're like, oh yeah, by the way, that one didn't work out. They didn't even make it through the academy. And so this helps to kind of refine and improve decision making if you've got that really close relationship throughout. Last point to make, cultural competence is really important. You need to be a culturally competent evaluator. And in this context, that means a couple things. Consider the cultural background of your candidates. Who are the people coming in? How do your tests fit or not fit with the cultural background of your candidates? Consider this during interview impressions. What are things that they may be presenting with that can be explained culturally, that you might otherwise, make some judgment about, but that it can be explained within a cultural competence. The other thing is you really need to be culturally competent within the populations you're evaluating. To work with first responders, you really need to understand first responder culture. It is a different world out there. And the other thing I recommend highly is that you need to screen yourself or your firm for bias. Do an adverse impact analysis. It's something where you can look at the data, you can look at your decisions and break them down across racial groups, gender groups, age groups, and to see, are you within that 4/5 rule? Are there concerns? And do you need to adjust your procedural inquiries to make sure that you are not guilty of adverse impact? Because that would be really problematic. So there's a lot of cultural considerations that come with this type of evaluative work. So last thing, I'm going to open up for questions, but I just wanted to include a couple of resources. There's the post manual again. This book on the MMPI 3, if you're going to use the MMPI, is a great one and has some wonderful case examples in it. The other book up there is a really wonderful resource for both pre-employment and fitness for duty evaluations. If you'll notice, the same author is consistent across the three, Dave Corey. He is one of the most important contributors out there in pre-employment work. I have all the world's respect for Dave. He has contributed so much. And I didn't even mean to just include his works. I was just thinking, what are my favorite resources? And these were my three go-tos. There's also some really wonderful trainings. These are all put on through the Concept CE is a company that does continuing education. They have a police and public safety kind of set of trainings. And I realized as I was pulling up the most broadly applicable, they're all Dave again. So you can see anything that has Dave Corey's name on it is, I guarantee, will be useful and helpful to you. There are other folks out there contributing. I have a Concept page up there that relates, but really these are kind of the most broadly applicable ones I thought would be useful. So with that, I think I left a couple minutes or a minute or two for questions, and happy to take those if we've got those, Anthony.
Yes, so thank you so much, Dr. Panza, for this very helpful overview. As you referenced here, we are near the top of the hour in terms of the content. We can stay on for a couple of additional questions. I would tell people, if you want the APA CEU survey, that is in the chat box now. You can save that link before leaving the webinar. And we do have a number of questions, and it's much appreciated you sharing a very, very clear overview of how to navigate this process for people that might be pursuing it. When you mentioned the different background information you dive into, someone asked if you could clarify how sexual behavior would be related to functioning as a first responder.
It usually ties into risk taking. When you look at background and sexual behavior, are there behaviors that would be considered inappropriate within the job? Sex in public questions on a regular basis. I've even had people that filled out a sexual history questionnaire and acknowledged that they can't make it through the workday without pausing to either view sexual material or engage. So again, these are kind of extreme level, but it is more in terms of appropriateness, relevant behavior, and anything that might impact the job. But you're looking within both a legal context and kind of an appropriateness and good judgment and decision-making context.
You had mentioned this concern about people putting, of course, their best foot forward doing these interviews, and someone asked, should tests or questionnaires given to applicants have low face validity so applicants can't guess what the desired answers are? And I guess just in general, how do you
Yeah,
account for this idea that we have to acknowledge that people are going to
yeah.
put their best foot forward given the stakes of the evaluation?
I mean, it's one of the hardest parts about doing these is that you know that you're probably, if not out or lied to, that's going to be minimized. You're going to get the best, shiniest version of the candidate. And to some degree, we know that. To offset that, you want to use multiple sources of data. That's why you want that background information to compare with your personal history information, to compare with your test results, to compare with your interview impressions. The more times you're asking people about these things and the more sources of data you have to corroborate and compare, the more solid your position is. And the other piece I think that's probably most important is the testing that you're using. Make sure your tests have good validity scales. It's why so many evaluators lean toward the MMPI in these. It's not because the MMPI is the be all and end all of tests, but it arguably has the strongest validity scales of most of the tests out there. And it really does give you an indication of how somebody's approaching it, how guarded or defensive they might be. So multiple sources of data and the strongest tests that you can include in there to look at.
Wonderful. Thank you. When keeping in mind that we're considering ongoing suitability, and you mentioned that we can't predict the future, somebody asked, when someone endorses prior mental health treatment, but it's from, say, 5 years ago, do you consider that relevant to get those records, or how do you consider maybe like past mental health history for
Yeah.
suitability?
Yeah, it's a great and very important question. And the easy answer is it depends. But it depends on both what the issue was, how much time has passed, and how open and comfortable and willing they are to speak about it. All of those things kind of come together. First of all, I want to explore what the issue was, what were the triggers, what might have led up to it, how impaired was the person at that time, how long lasting it was, what they did in response, if they sought treatment and they, went to therapy or counseling for a while and that really was impactful and they have a lot of insight about that. So, if there was a mental health history and it was 5 years ago, they pursued treatment was really valuable. They talk openly about how, I learned so much from this and it's changed how I do things now. And I have these supports in place and I plan to use them as needed going forward, that leaves me with a pretty strong feeling. Whereas somebody who acknowledges that they experienced some mental health issue, no, 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 I was fine. I didn't need the treatment, or, so it's a combination. Anything within a year, probably two, I'm going to request some input from that provider just because it's within that short window. The longer the window, the more they are comfortable talking and disclosing, probably the more confident I'm going to be that it's something that happened and that they've evolved from and gone forward.
In terms of general data, somebody asked, has there been a study specifically aimed at pre-employment profiles of officers who have committed unjustified shootings?
Um, n- nothing that Nothing that's particularly helpful is the easiest question I could say. Here's the glitch here when it comes to, or here's the challenge, I should say, when it comes to pre-employment screening and later on the job issues. Pre-employment, we're getting the person probably at their very best, right? They have worked hard to get this job. They probably, oftentimes they're younger, they're new, they're squeaky clean and shiny. And then we go and put them on the job. And what typically happens in first responder world is they don't take care of them. There's a huge stigma against mental health concerns. There has been so many barriers to treatment that again, we're actively working to break down and change that thinking. Um, the person that you usually see down the road that we hear about on the news who's had, some sort of inappropriate behavior or conducted themselves in some sort of abhorrent way, that person is likely a very different individual than the one that was evaluated when they were hired. There's a massive path in between pre-employment screening and what happens on the job. This is an incredibly stressful job, whether we're talking police, fire, dispatch, EMS, all of these jobs involve exposure to the hardest things in life. Trauma after trauma after trauma, organizational challenges, shift work, exhaustion. The job breaks people down. So the pre-employment is really important because it screens out those who we can see the vulnerabilities in up front. But the pre-employment does not predict who might struggle later. Who struggles later? Who's the person that conducts that horrific act that we hear about and see on the news? That's something that has evolved over time, and that there, again, probably a lecture for another seminar is, what are the things within a culture of a department that can lead to that sort of behavior happening, both within the individual and within the agency. There's really not a direct correlation between pre-employment functioning and functioning down the road. So many factors feed into who that person becomes over time with the job.
Mhm. Such critical considerations there.
Yeah,
Thank you for that.
absolutely.
I know we're running short on time. I'll throw out one final question here that somebody asked more about some confidentiality issues. And they said, how do you deal with preserving, say, a candidate's confidentiality in regards to their mental health history if you do indeed discuss concerns with the agency? I guess how specific do you get with those mental health concerns, and where do you draw the line between what you're going to disclose to an agency?
Yeah. Yeah, again, that's a great question. And I like the way that you actually rephrased it with how specific do you get? So, front, number one, the informed consent says anything you share here has the potential to be reported back. So they are very clear that anything they share. Does that set people up to not want to share? Yeah. But into some degree, to be able to get, move forward, you've really got to be able to talk about what's in your history. If they lie about it, that's an integrity issue and they're going to fail. If they share about it and talk about it and explain how it's no longer a factor for them, then that's a whole different issue to consider. That said, so the legal wise and ethical and all that stuff, I can share anything I want with the agency. That's one piece. But the how specific am I going to be is another question. We always want to be sensitive and balance the person's right to privacy with the right to inform the agency. So in my reporting or in my discussions, I'm going to share the minimal I need to share to have the agency understand what my concerns are. I don't need to give them every blow by blow of what this person's life has been like if that's not relevant to the job functioning. What I need to know or share is what specifically relates to that job, and what I think are the concerns that relate to their ability to perform on the job. So there's a real balance between the level of detail. I've seen people write, 7, 8 page reports that detail every aspect of the person's history, and I recommend against that. There's no need for the agency to know everything. The other thing that is true is that pre-employment psychological evaluations do not go into a general employee file. The decision form that we complete that says, basically pass or not pass, does go into their employee file. Anything else goes into a protected medical file. And so there is some degree of privacy, in terms of records and what's kept in the personnel end within the department or agency.
So, Dr. Panza, Nancy, thank you so much for sharing all of this work and all of these considerations for us. It's been an honor to know you over the years in a number of different capacities, and we definitely look forward to having you return to discuss a lot of issues related to first responder wellness. So it is much
Sure.
appreciated. Thank you so much for sharing your perspectives and this helpful information.
Thank you for having me. Thanks for listening and for such great questions. It was my honor.
And that wraps up this week's Law and Mental Health series. Next week, we have Dr. Dana Foreman, who will be discussing practical considerations regarding artificial intelligence use in forensic psychology. We hope to see you next week then for another great discussion of the issues in behavioral health and the law. Until next time, take care.